I first started experiencing knee pain, I guess about, I want to say maybe 8 to 10 years ago. And I was noticing that there was quite a bit of knee pain, but it's really become much worse in the past year or so, I would say. I think I put off visiting the doctor because I didn't want to disrupt my life, and it wasn't to the point where it was debilitating. I wanted to continue my job, I wanted to travel. Reached a breaking point back in November when I had my second cortisone shot. It made matters worse rather than improve. The holidays were miserable. I remember working on Christmas Eve. It started to snow and my husband had to come into the store and escort me out to the car because I was afraid to walk out to the car. And then we went downtown to a restaurant and he had to pull right up in front of the restaurant instead of parking in the parking garage like we always do. The pain has affected my relationships with people insofar as I feel like they have to do so much for me now. Everyone's been great, especially at work, and my husband, of course, does so much for me. But it's definitely altered my life. You know, people ask me to go to a baseball game, I can't go. Someone I really wanted to see in concert was just downtown, I couldn't go.
Probably for the last 10 years I've worked with her and I've noticed that the pain has gotten progressively worse. We're hoping that when she has had this replacement, it will change her life back again to what it was before.
My surgeon said that the rehabilitation would be, I would need to be absent from work for 6 to 8 weeks, and that it would be rather arduous and intense, the physical therapy, and the pain level would be high. But of course I'm experiencing so much pain right now that I'm really not that upset about that aspect of it. So I think I'm pretty well prepared mentally for what lies ahead.
I've been taking care of Pam for about 8 years. She's had a knee problem for a long time. Pam's situation is fairly typical for the type of patient that we see who would benefit from a knee replacement. She has bone rubbing on bone. She has significant symptoms to go with that, and she's really gotten to the point where her activities of daily living have become compromised by her knee. Knee replacement is one of the most widely performed procedures by orthopedic surgeons. It's a very predictable procedure. I tell my patients that they should be able to expect anywhere from 90 to 95% pain relief. I've recommended that Pam have the ATTUNE knee for her situation because I have a lot of confidence that it's going to enable me to provide her the most stable, the best functioning, and the best arc of motion for her.
So today is D-Day, the day of the surgery. I do have some anxiety, but I'm sure everything will be fine. I've been home from the hospital for about a week. My surgeon said to expect quite a bit of pain the first night, and there was. However, he did give me the pain meds to control the pain, so it hasn't been, for the most part, unbearable. The therapy is going well at home. There is some pain involved with it, of course, but the therapist is really good and taking it in small incremental steps for me. It's exciting because I can already feel as if I can do more with this knee than I was able to do with my old knee because it was in such bad shape. I'm actually not even using the cane or the walker anymore, which surprised me. So I'm about 2 weeks out from surgery now, and I'm starting to walk better thanks to the physical therapist who has visited. I can already walk better than I used to before the surgery. It's a strange feeling. It doesn't really feel like it's part of me yet. It almost feels as if I have an ace bandage on the knee, but then I look down and of course I don't. I've started to do some chores around the house. Every little thing just wears me out, but I'm trying to build my strength back up because I know it's important. This knee actually feels sturdier than my original knee. You know, I'm pretty confident about putting weight on it. I am back at work. I have my good days and my bad days, but I'm actually able to walk at this point so much better than I did before the surgery. My quality of life since the knee replacement has improved so much. It's just been like night and day. And now that I've had my knee replaced, I don't even think about it when I wake up in the morning. I just get out of bed and go make coffee and get the paper and don't have to worry about the pain every waking minute the way I did previously. I definitely love my new ATTUNE knee.